Okay, we can start.
Ready to go?
Yeah.
Great. Today's Thursday, so again, happy Friday Eve, as they say. And if you notice, guys, if I'm a little bit more lively, I just had, I think, 6 shots of espresso today. So if you notice that, yeah, I'm a little bit more up and active. That is why. Well, at any rate, today we're going to finish off the various flavors of differential reinforcement. And in case I didn't make this explicit last time, when it comes to the DRI, the differential reinforcement of incompatible behaviors, that is also a subtype of DRA, the differential reinforcement of alternative behaviors. So I kind of stressed last time how FCT, or functional communication training, is pretty much just communicative version of DRA, but DRI is also a subtype. So that may come up in the future. But suffice to say, today we're going to talk about the other 2 behavior reduction procedures using differential reinforcement, DRO, so differential reinforcement of other behavior, then DRL, differential reinforcement of lower rates of behavior. So let's get into that, and then we also have to touch on punishment procedures, and more on that in a bit. Just to start things off, again, today we're going to finish off differential reinforcement. Again, differential reinforcement is utilizing both reinforcement for some behaviors and extinction for others. Yes, so DRO, this is a biggie. This is essentially reinforcing the absence of a behavior occurring. Typically, you would think of this as similar to NCR, non-conditional reinforcement, where you set a specific time interval for duration, and if the behavior does not occur within that set time, then you would reinforce that. So yeah, it's essentially you're reinforcing the individual doing pretty much anything else besides the target behavior. And I have a example here after I see the pens come down. Yes, DRO. I'd say it's very easy. It's helpful to think about it alongside NCR. We can move on. Yeah, so for instance, if you have an individual who does a lot of table drumming, for sensory reasons, let's say it's automatically reinforced, and you want them to stop, you will then set a timer for 5 minutes, and if they don't engage in the drumming, then you would reinforce that with either praise, a token, an edible item, depending on what their reinforces are. However, if 4 minutes transpasses and they engage in the behavior, then you would reset the time and reinforce the next instance where the behavior is absent for that 5-minute duration. And I put a video here demonstrating this. Let's take a look.
All students forcing behavior that can't occur at the same time as the inappropriate behavior.
In this video, the RBT or cell wants the client, Brad, to remain in his seat. Each time Brad leaves his seat, the behavior is ignored.
So I believe this is DRA at first. They're just ignoring. He's probably doing it for attention.
However, when Brad remains seated, our cell rewards him with a verbal phrase.
The goal involves reinforcing the absence of all behavior versus
Miranda is working on reducing Lizzie's anxiety. If Lizzie does not engage in SIBs for the next 10 seconds, Miranda will reinforce Lizzie with further praise.
That's simple as that. Okay. When it comes to, back during the period of institutions where these individuals with mental disabilities would go to, usually the type of treatment, quote unquote, that you guys saw when you guys talked about, I believe, Wilkboro, or just those really large institutions where the individuals went to before day programs were a thing. They utilize a lot of DRO and punishment procedures. And DRO is just so easy to implement because, again, you just wait for the time to go up and then you reinforce if the behavior didn't occur, and you withhold reinforcement and reset the interval if it does occur. And there are several, I would say, problems with DRO. It's not usually an intervention we want to implement across the board, like something like DRA. So, for instance, I think you guys would recall a few months ago when we first started talking about the basic principles of behavior, and we went over the dead man's test. And this essentially says that if a dead person can do it, then it's not behavior, because behavior is anything a living organism can do. DRO does not allow somebody to pass the dead man's test, because, again, if they don't do something, that is not behavior. Because any old pair of skeletons can do the exact same thing, and you can reinforce that all day long. But more, I think a bigger concern is during that interval, they could be doing anything else, including other problem behaviors. So let's say we're targeting a disruption in the form of the drumming or property destruction, whatever the case may be. If they end up doing other things, such as you using profanity or spitting or flicking you off, that is not the target behavior. So then you would inadvertently reinforce that if it occurs during the interval. So yeah, different problem behavior can be still reinforced. And then it's not as easy as it seems, because you have to constantly keep track of the time and the individual to see if an instance of the target behavior occurs. Because if it occurs and you still reinforce it, then there goes the DRO. And same thing with implementing extinction by itself. The individual is not learning what they can do. Instead, you're just telling them what they can't. And that is not a way that we can have them learn. It's flickering, okay. Have them learn a new targeted skill. So that's why even if DRO is implemented, we always want to have ways for them to acquire the skills they need, such as DRA or FCT, or using chaining or discrete trials to teach them something, because otherwise, again, they're not learning anything. And I think right now with some of, just trying to think of an instance where I've used DRO recently, and the only time I can think of was when a client at one of the care homes, he would target the driver of his van as he's coming home from his program to the care home. And yeah, he was relentless. He would just say all kinds of mean things, a lot of profanity. So the only instance where I thought would be appropriate to use DRO would be in that, because whatever he would do in the transportation would be much more preferable than that. But at the same time, we were also making him aware through social stories. We also had a token board for him for just a little bit, just so then he can learn other things, as opposed to, oh, you cannot just do that in the transportation. You have these other options as well. So that is DRO. We'll touch base on when would be the appropriate means of utilizing it. But for now, the other differential reinforcement procedure is DRL. This is when a behavior that is not necessarily too problematic occurs, let's just say it functionally does serve a appropriate use. However, it's happening too often. And one of the common examples in a classroom setting would be when a student constantly raises their hands to get the teacher's attention. That is an appropriate way for them to get the attention they need. However, if it's happening too often, it may come maybe a little bit too disruptive. So instead, you're going to reinforce them engaging in the behavior for a preset limit of time. And we want to reinforce the interval in between the separate instances of behaviors occurring. That is referred to as the inter-response time. This is I think one example that is a little common, especially in this room, a client constantly asking, when is lunchtime? Let's say it's happening. Yeah, exactly. Let's say it's happening at an abysmal amount of time, 30 instances per hour. Oh gosh. So then you make the DRL goal to reinforce 3 times or lower per hour. So then if the client asks 3 times or fewer, then they can get reinforcement out in the form of praise, if that's what helps them, or access to a preferred activity, things like that. So that is DRL. Okay, coming back to DRO, if we are going to implement it, here are some of the things to keep in mind. You want to start off with a short enough, maybe I'm not sure if it turned off the recording. Yeah, you want to start off with a short enough baseline so then you can reinforce the absence of that behavior. And if it does occur during the interval, then you would have to reset. And then if it keeps happening at a frequent level, then you would shorten the interval. So then you can reinforce the absence of the behavior. And like I said, you want to combine DRO with other behavior acquisition procedures such as DRA, FCT, get some DDD trials in to teach them some much needed skills. So then they can actually access reinforcement in a much more appropriate and natural manner. And then for DRL, it's kind of similar. You want to choose a appropriate level of a baseline for the number of instances for the behavior. So for instance, if the baseline for the asking where is lunch is about 30 instances, then you want to start the DRL procedure at 25. So then if that is absent from the initial baseline, you can reinforce it, and then you can continue to reinforce it as the behavior decreases over time. Starts off at 30, you reinforce at 25, and then it keeps going down to the point where you would get a more appropriate target, more or less with 2 to 3 instances happening within the hour. Yeah, because we got to meet them at where they're at, and we want to reinforce what we're targeting. Yes, and then we do not want to use DRL for behaviors we want to see more often, because again, we're trying to decrease them. They're appropriate, but in excess, they can become disruptive, so we want to keep that in mind. Now, there is DRH, reinforcing higher rates of behavior, but those don't fall into behavior reduction. So the target responses for DRL are ones that are appropriate, but again, have been a little bit too much to be useful. Okay, then we got some quick questions here. So a client asks for a bathroom break every 5 minutes, just so then they can walk. We only want them to do this ideally once an hour. So what do we use here? Do we use DRO or DRL? Yes, DRL. Yeah, And again, there's a particular culprit in mind for this one. Using the restroom. A client picks their skin. You give them a sticker for every 10 minutes. Their skin stays clear. Is this DRO or DRL?
DRO.
Yes, that's right. After the 10 minutes is up, they get the reinforcement. A client shakes hands with every person they see, often 25 times or more an hour. This interferes with their routine. You then reinforce the client if they shake hands 5 times or fewer during the morning. DRO or DRL?
DRL.
Yes, DRL. That's right. Cool. That's it for the DR procedures. Any questions before we move on to punishment? Good.
I had one.
Yeah,
For the
yes.
DRO,
Yes.
just the example that you gave for drumming the table.
Mhm.
Stopping drumming. What if it were, it's pretty much any kind of, maybe not any kind of, but like, let's say from the drumming the table being from drumming the table really loud and
Yeah.
to being distracting to, I don't know, maybe like clapping. I mean, would that be?
Yeah, you can have
Something
multiple you can have multiple targets for DRO.
As
If
long
that's
as
what
it
you're
draws
asking.
away from that specific goal, in this case, drumming the table.
Mhm.
Moving it on to something else. Right?
Yeah, but that wouldn't be DRO. That would be more or less DRA because you want them to do something else.
Got it. Okay.
With
So
DRO, it's simply the absence of the behavior. That's where your reinforcement.
I see.
Yes.
I-
Yes,
Okay.
which is why it's important for us to choose DRA over DRO.
Got it. Okay.
Great. Oh, great question, Jonathan.
So that kind of DRO thing would be helpful, like if there were maybe more, I don't know, like during quiet, not quiet, but more calming times of the day, perhaps, or less activities going on, maybe.
I would say we would only choose to implement DRA or DRO rather if the behavior is incredibly disruptive, if it's severe to the point where pretty much anything else the individual does is better than the target behavior.
Okay. I'm
So-
thinking in my head, like when is a more appropriate time?
Yes, so if there is a period where it would be appropriate for the clients to, let's say, be a little bit more quieter, they're doing a group activity that does require it, then implementing, again, I would just try to target attending to the activity or participating as opposed to the absence of disruption. Like I said, the only instance where I've used DRO recently is when you have a client spewing out profanity across the board to this one individual. And again, anything they do is better than what they're saying. Because unfortunately, in this case, there were some racial slurs thrown at the way of the driver. And we did not want that. We just wanted to avoid that because he even came into the home once while I was there, and he told us, "Yeah, I don't want to have to take him home tomorrow because of what he's doing."
I see.
Yeah.
Yeah, that makes more sense. It's clearer to me now.
Okay, great.
Yeah.
Great, I'm glad. Anything else, guys? Yes, DRA is king. Okay, let's get into punishment procedures. Now, I think the most important thing to recognize when we're talking about punishment is the 2 reasons why we have to bring it up in the first place. One, it's on the curriculum. And if you take the RBT exam, it's definitely going to be on there. But 2, I think it's important to be aware of what the punishment procedures are. So that way, if we're inadvertently put them in effect and we don't have the approval to do them, then it would just be very useful for us to be aware of what they are, so then we can avoid using them. Because as you imagine, punishment is something that is incredibly adversive to an individual. It's very unpleasant, and it should only be used when everything else has been off the table. So we'll get more into that in a moment. Now, when we talk about punishment in the context of behavior analysis, it is a technical term. We can think of it colloquially or just in common usage as being vindictive or instilling harm on somebody because they did us wrong, they did us dirty. That's not what it is in ABA. Whenever we talk about punishment, it's about decreasing the future occurrence of behavior. It's not about getting back at somebody. It's not about hurting them just for the sake of hurting them. No, it's solely about decreasing behavior. Yeah, so if behavior goes down, we would say that the stimulus that did that in effect is a punisher. Now, there are very few instances, again, that we would even entertain the idea of utilizing punishment. It is only when we've tried all the reinforcement strategies we can think of, we've done everything we can to contrive the MOs and use DRA and FCT. But if the behavior is still occurring and it's very severe and dangerous for the individual, then that is only the instances where punishment may be something we could consider. Again, I can only stress enough just how much it's something of a last resort. Mm-hmm. Yeah, I want to play this video for you guys. If we have time, we can play the other one as well.
Something clicked for me. But so I came up.
Oh, something clicked, but not the volume.
Yeah, something clicked for me. But so chemotherapy, right? Everyone's familiar with chemotherapy, right? It's a highly intrusive medical treatment for advanced stages of cancer, right? It's pretty common, for folks who have cancer, right? So it has a whole host of negative side effects, right? It literally, the chemotherapy, the treatment itself can kill the patient, right? Punishments like chemotherapy, right? It's a highly intrusive procedure that has the potential for a whole host of negative side effects. However, if the condition is severe enough and warrants that level of treatment, right, it's appropriate or clinically indicated to use it, right? So people don't call doctors who prescribe chemotherapy unethical, right? In most cases, right? I mean, if a doctor's prescribing chemotherapy because you walk into their office with a lump on their arm, they don't do any tests, like, oh, chemotherapy, like that would be problematic, right? Because the lump could be caused by anything, allergic reaction, right? So the take-home message here is, it's not the punishment itself that's unethical. It's when people don't do the proper assessment. They don't determine what the function of a behavior is before developing treatment and ensure that they're using function-based treatment, right? Those are the areas that are unethical, not the use of punishment itself.
Yeah, exactly. If we have time, I want to play just one of the very few instances where punishment can work. We'll come back to that one if you get a chance. So just like with reinforcement, you can think of punishment as the other side. Just as reinforcement increases behavior, future likelihood, punishment decreases, which means there's also positive punishment and negative punishment. Positive punishment is when you add an aversive or unpleasant stimulus to the individual's environment that leads to the decrease of future behavior. Just a few examples. This would be overcorrection in terms of reinstitutional overcorrection. This is where not only do you have the individual do something to correct the behavior they did, but then you also have them do something on top of it. So for instance, if a client knocks over a chair, not only do you require them to get it back up and place it where it goes, but then you also have them do some other tasks like cleaning the table, sweeping the floor, taking out the trash, just so then that behavior is punished to the point where they don't want to do it anymore because, oh man, now I got to do all these other things on top of that. And then in terms of overcorrection, positive practice, This is when you have them keep repeating the correct behavior over and over, and the practice of it becomes so aversive that they don't want to do it, the behavior, because then, oh, they got to do the correct thing over and over and over and over again. And then response blocking, the actual disruption of the response being emitted is enough to serve as the punisher. But some other common ones would be reprimands. So telling a client, no, you cannot do that, or in a very stark and aggressive tone, that may be enough to deter them from engaging in the behavior because they don't want to hear us reprimand them. Now, of course, if the reprimand actually leads to an increase of behavior, let's say they like the attention they're getting, they don't care whether or not it's praise or what sounds like a reprimand, then it's not a punishment. Then it's being reinforcing. But if it actually leads to the decrease of behavior, that's when we would say it's punishing. On the flip side, negative punishment is when you take something away, typically something desirable or something that the individual likes, and then that leads to the decrease in behavior. And with punishment procedures, as you could see, there are many ways you can introduce an adverse stimulus. Whereas with negative punishment, you really only have two procedures on the table. That is timeout, which is commonly misunderstood, and response costs. So with timeout, the individual is removed from a reinforcing environment, whether or not that be spatially or the reinforcing effects is removed from them while then not being removed from the area. More on that in a moment. And then response costs, we can think of this as a fine. You break the speeding laws and the highway patrol catches you, well, they're going to put a fine for you for some abysmal amount of money. And then that is punishing. So that will deter you from engaging in speeding. Yeah, so the example I have here, an individual throws something and now they miss out on 5 minutes of their break. Something desirable was removed. There are two primary types of timeout. Non-exclusionary, this is where the individual stays in the reinforcement environment, but they do no longer get access to the reinforcements. So for instance, if they are primarily reinforced by attention, they can stay in their area, but then you remove all attention from them and ensure they don't get anything. And then that would act as punishment. Or if they're enjoying their music and they do some target behavior, you would then turn off the music, and then that would serve as punishment because you're removing it from the environment, but they're still in the same area. And then exclusionary is when you remove them from the reinforcement environment. Yes, and it's very important to stress that timeout only serves as punishment if the reinforcing environment is actually reinforcing. It's just like with the example of reprimands, if the individual engages in a problem behavior and it leads to them being removed, let's say an example of exclusionary timeout, and they keep doing it, well, technically speaking, that's not punishment, that's reinforcement, negative reinforcement, because they're getting a chance to escape whatever environment they find themselves in, which again stresses the point that the behavior analyst in that video was highlighting. Got to understand what the function is if we're going to implement a proper procedure. Because if we're just doing things on a whim, implementing timeouts just because we think it's going to be punishing, and that's actually negatively reinforcing, then we're kind of wasting our times and we're implementing punishment when we shouldn't. Okay, yes. Dismanage unethical risks. I don't think that needs to be stated too many times for it to come home. But yeah, punishment is undesirable, not just for the individual, but I would even go as far to say for those implementing it. because it can just lead to all sorts of issues. The increase in other problem behaviors such as emotional outbursts and aggression. Whenever an individual implements punishment, they themselves become aversive. So the individual who is getting punished is going to want to avoid them, and who can blame them? Also, we're inadvertently modeling punishment for them, and that is not something we want to do, especially considering, like DRO, you're not teaching them anything. And if anything, they're learning from your punishment on this is how you stop somebody from doing something undesirable. That is why we want to leave that to the very end, not really consider implementing punishment unless it's really our only choice left on the table. And again, this is after doing a functional analysis, trying all sorts of DRA procedures. Okay. Well, with that being said, just like with any behavior procedure, there are few instances where it can work. Again, stressing to the point where it's approved by the behavior
verbally, if you want, if you will.
Yeah.
It was hard to determine because he wasn't communicating verbally, if you want, if you will, or using his words appropriately. So we didn't really know because he's considered severe.
Oh.
It's in the spectrum, and we didn't know when he was, because he would just cry. Fucking mostly Marlene, but we did. That was just lazy. Not that I was implementing extinction. I just was lazy. Like so Ben would,
Oh.
and she's like, "You want drink? You want food?" And then so he did was flail around screaming. But then at some point we realized that there was a couple men.
We'll talk about man tomorrow.
One of them was,
Wiggling it in the TV.
and I forget the other.
That doesn't want.
For
I really
the
touched
basic unconditioned reinforcers like food, some conditioned reinforcers like tangible stimuli, and then him realizing that words got him what he wanted. So again, it was totally against Marlene and a parent's instinct to not offer things because number one, he would stop screaming and flailing himself off of furniture, but you don't realize it as a parent because then you look at Ben and he's like freaking like 190 pounds flailing off furniture. I mean, he was young. He was like maybe like 90 pounds, but he was, he couldn't communicate. So for families, it's really hard because you don't know when is it that they can command appropriately versus having an operant behavior in the environment that's getting them reinforcement for inappropriate behavior.
And they see that behavior ceases, so they think it works.
Yeah,
Right. Right.
And that's the big problem. One of the biggest drawbacks of punishment is no, it could be extremely effective. Right after you deliver some unpleasant, undesirable stimuli, there's some reaction that's like flailing around and unpleasant. Like if you did the stimulus avoidance assessment, the back away, the scream, it was unpleasant. There was some sort of noxious stimuli or whatever. And then the parent or teacher thinks, look, it didn't work. Look what he did. That's not the part that matters. It's the next time that the conditioned punisher pops out, like whatever it is that was previously the stimuli that signified punishment's coming. So there's a common misunderstanding and a common problem is that parents, teachers, and behavior analysts even think that a punishment didn't work because of the reaction they got. But it was very undesirable because there was respondent aggression, which would be the clinical term. However, all that matters is the future behavior, did it decrease it? And that's a big, big pain point where I don't think schools and parents really, they just see the unpleasant response and not.
Yeah, he threw a lot of technical language there at the end. But all he was really saying is similar to when extinction bursts occur. Remember, when you stop providing reinforcement and the individual starts engaging in emotional outbursts and aggression to get the reinforcement they used to get. Very similar when you start introducing adversive stimuli to punish them. That's yeah, essentially what he was trying to say in a nutshell. But if it wasn't clear by the audio breakage, the young man with autism that he was talking about, they began using this response cost to when he has instances of aggression, when he was throwing himself and failing onto the ground, just to be able to create the absence of the problem behavior, so then they can implement functional communication training, the MAN training. So in that very small instance, that's when something like punishment could be considered. We talked about these. Okay, yeah, best practices. These are only, with a big caveat, only if it is approved for the punishment procedure to be on the individual's EIP. Now, I don't think Alta would ever let it slide to have a punishment-based procedure in a client's behavior intervention plan. But again, this could be something you guys may be quizzed on or tested on for the RBT exam. Just like with reinforcement, you want to provide the punisher immediately after the behavior occurs. That way, the contingency is created between the behavior and then the consequence. You don't have to make the situation a lot more adversive than it actually is, than it already is. So you would deliver it very calmly. So in this instance, the response cost is delivered at a calm, neutral voice. Because you hit, then you lose 2 minutes of music. Just like with the RO, you always need to have a reinforcement plan. Just like with the example of the young man, they incorporated functional communication training as soon as there was that absence of aggression and property destruction. And the punisher, it's supposed to lead to the decrease of behavior. And if it's not decreasing, then we got to go back to the drawing board because it's not working. And there is no reason to keep incorporating an unpleasant experience for the individual if it's not for their benefit. Ultimately, it is for their benefit. Just as that behavior analyst was sharing that you wouldn't implement chemotherapy on somebody who wouldn't benefit from it because it is such a huge risk. And I think I have questions. Okay. Any questions regarding punishment before we move on? Yes.
Punishment.
Yes, punishment. Hot topic.
So, punishment.
Good. Good moving, guys. All right. An RBT is working with an adult who frequently slams doors. Every time the client slams a door, the RBT has him practice opening and closing the door quietly 10 times. What is this an example of? Julie saying positive punishment. Everybody in agreement?
Yeah.
Yes, this is overcorrection. Because you did this, we're going to have you do it over and over again. And by having you do it over and over again, that should lead to the decrease of the behavior occurring again in the future. Good. A client is earning tokens for a community outing. Ooh. After the client hits a peer, you then remove 2 tokens from their board. What is this procedure?
Negative punishment.
Negative punishment. See? Yes, this is a response cost. Again, think about a speeding ticket. You did something against the rules. So in order to deter you from doing that again, there's going to be something desirable removed from you. Client is removed from a party and placed in a quiet hallway for 2 minutes after they threw food at a peer. This is exclusionary timeout. For this to be effective as punishment, what must be true? That the party must be more reinforcing than the hallway must be scary and uncomfortable, the client has to apologize before returning, or you must lecture them about their choices in the hallway. Letter A, let's see. That is right. If it isn't the case that being removed from the reinforcing environment to a punishing environment is not the case, then we can only make two assumptions: whether it's either going to be the case that it's escape, negative reinforcement, or it has no effect on the behavior because the party and the hallway have no real differences in terms of punishment or reinforcement. They could be both considered neutral stimuli for all that matter. A client is watching a movie. After they hit appear, the staff turns off the TV for 2 minutes. What type of procedure is this? Well, then you guys are good. Yes. This is negative punishment. This is non-exclusionary timeout because they're still in the environment. They didn't move anywhere, but the reinforcement was cut off. I think this is the last one we have here. Why is it considered an ethical best practice to avoid using DRO as the only intervention in a long-term behavior plan? Because it doesn't teach the client what to do instead. So because it results in aggression, it's too expensive or difficult to implement, or requires restraint.
Hey,
Amazing job, guys. Yes. It's A. Again, just like with punishment, DRO, extinction, you do not want these to be the sole intervention. You want to incorporate positive, reinforcing procedures. So then they have something that they can use that is functionally equivalent. Great. No, seems like you guys got a good grasp on that. Any questions before we close things off?
today, it's changed.
Positive, negative punishment, DRO, DRL, DRH. Oh, we're good? We're good, guys? Awesome. Great. In that case, we'll pick things back up tomorrow. Yes.
Yeah.